Okay, welcome everybody. Thank you so much for joining us. Today we are joined by psychosexual and relationship therapist Aoife Drury. Aoife, thank you so much for chatting with me today.
Thank you for having me on. I'm delighted to be here.
So, tell us, just give us a little introduction. Tell us about yourself and your practice.
So, I am a psychosexual and relationship therapist. So, I see people struggling with sexual health issues, difficulty with intimacy, with their sexuality, perhaps, and sexual dysfunctions. And I see individuals and couples. And currently, due to COVID, I'm online, but I would normally see people in a Dublin clinic.
And so today, like we're talking a little bit about therapy and how it relates to gynae cancer. At what stage would you say most people go to seek out a therapist when they're on their cancer journey? And what stage would you actually recommend people go to seek out a therapist on their cancer journey?
Yeah, I suppose it's different for everybody, and it's different depending on the level of treatment you receive that perhaps needs that added bit of support. It may be due to the support systems you have around you being insufficient or good enough, depending on your own judgment. And also, I would say it depends on the struggles you're having with either the diagnosis, the treatment, or the after effects that may still be sitting with you. So, in my perspective, I'd encourage people to reach out when they feel overwhelmed, when they feel like it's a bit too much for them to be managing, and they need that extra bit of help. And so um, that's irrespective as to what stage they are in, but more so about how they're feeling in themselves and making that judgment and talking to partners, friends, and even healthcare providers.
And what are some of the more kind of specific challenges that you would see clients coming in with and needing help with, specifically with gynae cancers?
Yeah, I think the most prominent thing that I've seen is painful sex. So, particularly perhaps dyspareunia and maybe even vaginismus, challenges in self-lubricating, changes in libido, perhaps anxiety around getting intimate again and tapping into desire because perhaps there's fear or the anticipation of pain. And so those tend to be more common in what I see in my practice. And also that falls into relationship dynamics as well. So maybe a struggle with communicating or understanding each other and what's happening for each other and needing that extra help because that plays out outside of the bedroom and in communication, in conflict, and maybe child rearing, and maybe anxiety and stress around engaging in work. So it can be quite multifaceted. But really, it tends to be a bit more in terms of the physical side of things that come into my therapy room.
And like, how would you help clients to sort of reframe their thinking around sex and their body once they've had a diagnosis and they've gone through treatment? Things can, like you said, change dramatically in over the course of treatment and into recovery. So how do we reframe some of our thoughts around sex?
That's a really good question because depending on the treatment that's been received, sometimes sex is off the table in terms of being penetration. So what I really encourage people to think about, if that's a struggle for them, is reframing it as intimacy and connection and just touch and taking off the sexual side of things and looking at sensual aspects of touch. And I think it's important to, whether that's an individual and having physical touch themselves, mindful masturbation, sensory components in the shower, even something like a weighted blanket. It's all about trying to think about touch in a different way. Um, and then within couples, perhaps it's about keeping things very simple and going back to those basic parts of connecting with each other, connecting with your body, learning about your body, learning about your partner's body, and then also just perhaps taking kind of penetration off the table, any form of penetration off the table, and reintegrating it back in, because sex is whatever you define it as being. And so I would encourage people to think about that. What does sex mean to me? What does it look like to me? And how would I like to engage with it in a way that's perhaps deeper than maybe the way I looked at it before?
Exactly. Like it's such sex is such a huge umbrella and there's so much underneath it. I think oftentimes we tend to think of sex in what like one particular way because we mightn't have gotten like the proper education, the proper vocabulary for things in our education system. So it's really nice to think about things as a much wider spectrum of activities that you can enjoy. When someone is seeking out a therapist specifically for cancer, what are some of the kind of key words that people should be looking for? Because we know not all therapists practice in the same ways. Some people will have specific, specialties. So what would be your advice when looking for a therapist?
Yeah, that's a good question. And it's a question that I get asked all the time by, friends, family, peers, on Instagram, who am I and how am I supposed to find a therapist? And it is quite overwhelming. If you do go onto a site like IACP, you'll just scroll through so many different names and specialities, and that's really difficult. I mean, I'm biased, but I would be looking at a psychosexual therapist, and that is because they may have a better understanding as to the physiological components of gynecological cancer. And so I would be suggesting to go on COSRAT, which is my accreditation body. So that's COSRT.org. And just finding a therapist that looks, even physically looks like they'll be a nice fit for you, and read and explore their website. But in terms of words, what I would firstly do is sit down, pen and paper, and think about what's happening for me. What am I struggling with? Because everybody's individual and unique. And so maybe somebody's struggle is overwhelming for them, but not so much for somebody else. So if it's even something simple as anxiety, maybe you won't need a psychosexual therapist. If it's something like painful penetration, then perhaps I would be looking at a psychosexual therapist to support. And then just look for words that feel like they fit for you. So if it feels traumatic, for a trauma-informed therapist. If it feels that it's related to thoughts, perhaps it's more of a cognitive behavioral type of therapy. So it's about trying to figure out what works for you, but explore and never ever think that you have to stick with one therapist. If therapist doesn't feel like the right fit, that's okay. There's plenty more of us to go around.
And finally, apart from one-on-one sessions, what are some other resources and supports that you can think of, like community supports or like group therapies, to help people along their cancer journey?
Yeah, so what I would be thinking about, if even I go back to maybe the first few questions, one of the first questions that you asked me was about getting in tune with your body. There's a really good app called Ferly, FERLY, and that allows you to do everything from mindfulness to mindful masturbation to erotic stories. It's partnered play, it's individual, and so it's kind of that reframing of thinking of sex in a different way, thinking of sex with an added part of technology. And so I would be, encouraging somebody to reach out there if they feel like a therapist isn't quite right. I would also recommend there's a Vaginismus Network who do amazing events. You can find their website or you can find them through Instagram. But even things like mindfulness, Headspace, Calm, those apps are really brilliant to be able to just reconnect with yourself, decrease anxiety, and increase a little bit more of connection with yourself. But equally, there's not to isolate it to individual therapy, but there's couple therapy as well. Couple therapy support that's out there to help you both navigate your way through it.
That's wonderful. Aoife, thank you so much for talking to us today. And thank you so much for the wealth of information you've given us.
Thank you for having me.